Hey guys, it's Manu, physical therapist and herbalist. So in this video, I'm going to show you a couple of lumbar traction techniques. So these techniques are helpful for certain low back problems that respond well to traction to relieve the pressure or the compressive load on the discs, the joints, as well as the nerves. Keep in mind, not all low back problems respond well to traction, but for those of you who find that you're load sensitive, meaning that whether in standing or sitting, any position that puts too much compressive load on the spine, you respond well to unloading the back, meaning laying down, for example, which takes some of the pressure off, or in quadruped or all four positions, which once again relieves some of the compression on the spine. You will do well with these two techniques. They're pretty easy techniques and you can do them yourselves. So the first one we're going to do is laying down. So what you want to do is you want to make sure you have something that you can grab onto overhead. So a headboard would work well. Keep in mind to keep your knees bent. That makes it easier on your spine. You can always put a few pillows under your knees if it's too hard for you to keep your knees bent in this position. I'm going to be reaching up overhead. I'm going to grab onto whatever I can get a hold on, something that's stable. And I'm essentially trying to pull myself upwards. Okay, as you can see, as I pull myself up with my arms, I am taking the pressure off the lower part of my body. Okay, I am unloading the lower part of my body. Now, there's not a lot of traction that you're placing upon that spine, but it's significant enough that a lot of times people find good relief with that. So easy enough to do yourself. I pull up and I hang out here. You can hold that position 15, 20, 30 seconds, and then you slowly release, right? And you release, that pressure comes back onto the spine. So it's a good way to do intermittent self-traction of that spine. And if you feel that compression is too bothersome for your spine. So the second way to do this is you could do it edge of the bed. If the bed is high enough, use a kitchen counter, even a dining table, or you can use two chairs. So I'm going to use the edge of this treatment table. What you want to do is, I'm essentially going to do a kind of a dip, front dip. So I'm going to hold myself up in this position, and my feet are still on the ground, okay? And I'm going to let my lower body hang down gently. All right, so the weight is on my arms, and I let my lower body sag down, and what that does is the weight of the lower body pulling down takes the pressure off your spine. So I'm holding myself up on my arms, and some of my weight is on my feet too. So I might hold this position at a time for whatever you can tolerate. So let's say we start with 15, 20 seconds, and you can work up to about a minute if you need to. All right. So, and then I would come back out of that position. So make sure you bring your feet under you, and you come up to a standing position, keeping your body nice and straight. Okay. A lot of times what people tend to do is they're hanging out in this position, getting traction, and then when they go to get up, they tend to bend forward and try to come up, and that's not a good position to come. Not a good way to come out of that position, because again, you're putting yourself in a forward flex position, which can cause irritation and pain as you're coming out of that somewhat of a decompressed position. So be careful about that when you get out of those positions, okay? So the first few times when you try the traction, make sure you do it about just a few times, maybe 3 or 4 times, and then assess and see, how does the spine feel after that? Does it take away some of the pain off my back? Maybe off of the buttock area, maybe even if I have sciatic nerve pain going down to the leg, does it relieve some of that pain? So that gives you an idea how you respond to that, okay? The other thing you want to keep in mind is not to do too much traction initially. Sometimes what happens is, if you're doing excessive amounts of traction, you'll feel really good initially, but then afterwards, there's a rebound effect, and then in fact you can have more pain. So be careful with these techniques. Though they're very simple and you can use them right away, they're a good way to test as well as to work on doing traction for yourself. All right? So if you have any questions, leave a comment. Go check out the site. I have lots of information on my site.